edition of Northwest Newsweek. I'm Riley McManus. Tragedy struck Friday morning on the Sandy Lake First Nation following a house fire that has claimed the lives of 3 children. Sandy Lake is located about 600 kilometers north of Thunder Bay. The chief says the community is devastated and that the children range in ages from about 4 to 9 years old. The mother and 3 other children escaped while the father was at work. Investigators, relief police officers, and 2 coroners arrived in the community late Friday. Anishinaabe Nation Deputy Grand Chief Bobby Narcisse is offering condolences to Sandy Lake and thanking first responders for braving the extreme cold at the fire scene. There appears to be differing realities between those asking for and providing military supports for Bearskin Lake, which is contending with an outbreak of COVID-19 that crippled the community and made national headlines. There is also discussion as to how to address the recovery for the community, which fortunately has seen a reduction in the numbers of active cases. Adam Riley reports.
The boots of Canadian Armed Forces personnel have hit the ground in Bearskin Lake First Nation, a community that has been devastated by an outbreak of COVID-19. A release from the Ministry of National Defence indicates a total of 10 Canadian Rangers have been activated, some of whom were already in the community in isolation. Last week, there were outcries as to what was taking the military so long. Indigenous Services Minister Patty Hajdu says there is a protocol around bringing in the armed forces for support that required an official request, not in the form of a press release or public statement.
It can create confusion, and it's not necessarily the best way to plan from the military's perspective on how to use limited resources in a time where all of the country is under surge.
But despite word that military personnel had arrived, community members have taken to social media countering that narrative. One stating, "Hello Houston, we have a problem. There is no military or rangers here." A release from the Anishinaabe Nation speaking on behalf of Chief Lefty Kameda, who has since tested positive for the virus, says as of Wednesday, only 3 rangers had arrived and 2 of the 4 rangers from the community were unconfirmed and potentially still in isolation. Kameda says he is frustrated with the response. On Thursday, while providing an update to media, Hajdu says she has spoken with the chief to try to address those frustrations.
Today, he mentioned additional gaps and some potential vehicle needs. So, I've raised that with the deputy minister already to try and figure out what those gaps are and what those vehicles are needed.
Hajdu says a large contingent of support in the form of medical personnel paid for through her ministry have arrived to assist the community. Meanwhile, the MP for the Kenora riding, which includes Bearskin Lake, says while it's great the federal government has responded to the emergency, a long-term approach needs to be discussed. Eric Malillo notes many of the conditions, such as limited housing and medical infrastructure, allowed the virus to spread so rapidly in the community. He hopes that as this crisis is addressed, there are resources put in place to prevent a similar situation in the future.
Any support, any logistical support that the government can give to help keep that continuous and ensure that the community has the coverage is going to go a long way. But obviously, looking forward, there's a number of concerns in the sort of the medium and longer term of the support and the resources that this community needs, and many across the north need to be better equipped for the potential of future situations such as this.
As of Thursday, the number of active cases in the community has drastically dropped to 47. Adam Riley, TBT News.
A shocking video which appears to show Kenora OPP officers engaged in a downtown shootout is in fact a fake. The 30-second video was posted on social media Monday night and then removed about an hour after its posting. It showed what appeared to be police firing their guns outside a gas station on Chipman Street. Some people online began to notice that some things in the video just didn't add up. Constable Jason Canfield says officers did respond to a call in that area that night, as seen in the video, but the audio was not real, as no firearms were discharged. Canfield says they received numerous calls from panicked residents about the video. A police investigation is now underway and charges of mischief could be laid.
It did alarm a lot of people, and a lot of people did believe that this was real. It was put up in order to mislead people. Like, you wouldn't put something like this up if you weren't thinking that someone was going to think it's real. So yeah, there is an investigation right now regarding this and trying to put a stop to things like this in the future.
Kenora OPP do have names of potential suspects, and while social media profiles can be difficult to track, there are resources from social media companies that will assist police. The COVID-19 situation in Thunder Bay is only expected to get worse, according to the district's medical officer of health. Dr. Janet DeMille is expecting a peak by the end of the month. The health unit will soon ramp up vaccination clinics to counter the spread, with a focus on the youngest eligible population. Corey Nordstrom reports.
We have a lot of COVID-19 in Thunder Bay. We have more right now than we did at any other point in time in the pandemic.
Though it's now harder to get an accurate reading on active case numbers, DeMille is confident local cases are still rising daily. The Thunder Bay District is also reportedly seeing more outbreaks and higher rates of hospitalization than some of the worst times since the pandemic started. And the medical officer of health is expecting things to worsen over the coming weeks.
I'm hoping that we will peak sometime in January, maybe by the end of January or at least early February, and then we'll start to recover with less outbreaks, lower numbers overall, but it will take another, 4 to 6 weeks to sort of recover for that.
In efforts to control the spread of the virus, more vaccine clinics at the CLE's Heritage Building will run from the 21st until February 11th, a main focus being the 5 to 11 age group. Just 50% of those children are vaccinated against COVID-19 at this point, and DeMille is hoping more will get the shot after the group saw just a 1.6 increase in uptake last week.
It sort of slowed down and as we approached 50, and now I think there was a little bit of an uptick recently, but certainly that does suggest that a lot of parents are out there that haven't chosen to get their kids immunized.
And by getting children in the youngest eligible range vaccinated, they're protecting the rest of the family, including those under 5.
One of the age groups that I'm particularly concerned about is those individuals 0 to 4 who aren't eligible for immunization. And I know that many kids 5 to 11 may have siblings who are not eligible to be vaccinated.
DeMille says it's best that kids get back to the classroom, though she knows there will be complications and warns that canceled classes and school closures are a possibility. The Lakehead Board has announced that canceled classes will be treated similarly to snow days, with notifications on the school's social media the night prior or the morning of a cancellation. Corey Nordstrom, TVT News.
The area's childcare centers are about to get the same resources as elementary and high schools to prevent the spread of COVID-19. The Thunder Bay DSAB is expecting to receive a shipment of rapid antigen tests and personal protective equipment for licensed daycare workers around the district. This comes after the province's recent announcement that childcare staff will receive priority status over the vaccine as well. DSAB Director of Integrated Social Services, Ken Ranta, believes that this distribution adds another layer of protection.
We have 45 licensed child care centers, and that's all throughout the district of Thunder Bay. So all of them were eligible to receive the test kits. They're also eligible to receive direct deliveries of enhanced personal protective equipment, N95 masks and other gloves, shields, and other materials as well.
The DSAB has contacted child care services in the district to let them know the COVID-19 tests and PPE will be delivered soon. It is unclear exactly when the shipment will be arriving, but as Ranta says, the province mentioned sometime later this month. The hospital in Fort Frances is contending with an outbreak of COVID-19. Following the arrival of the virus into the facility last Saturday, it comes at the same time as another facility in the Rainy River District battles another respiratory outbreak. Adam Riley has more.
We've really been pretty aggressive in our measures, to be honest. But again, the variant has entered our facility.
On January 8th, the La Vérendrye Hospital announced it had a suspected outbreak of COVID-19, with one patient testing positive for the virus after they had been admitted into the hospital.
Were we able to track where it came from? We were not able to. But according to the standards, 2 cases would then implement that you would be in a COVID-19 outbreak if in an acute care setting, which is the case.
By Thursday, Loveday says that outbreak had grown to 5 cases, with both patients and staff affected in the hospital's inpatient unit, which houses surgical, obstetrics, pediatrics, and the ICU. Fortunately, the outbreak appears to have been contained, and while some staffing issues have arisen, it hasn't required the hospital to recall staff off sick. Loveday wants to assure the public that they can still receive care at the hospital despite the outbreak.
Don't be afraid because we're in an outbreak. We have very strict isolation and infection control practices. We've ramped up high-touch cleaning. We're doing everything we possibly can. Of course, if you don't need to come to the emergency department, probably not a good idea to come. However, if you do need medical care, you need to come.
Loveday says while it is unfortunate they're having to contend with the situation, she is happy it's the only COVID outbreak, as an outbreak announced at another Riverside facility is non-COVID related. On January 9th, a respiratory outbreak was declared at the Rainy River Health Centre. As a precautionary measure, all those with symptoms were tested for COVID, and all tests have come back negative. Loveday says, like a similar respiratory outbreak at Rainy Crest Long-Term Care late last year, precautions are taken to prevent interfacility and interdepartment staffing.
So because of that, so a staff member may work here at La Vérendrye Hospital, but they also work at Rainy Crest, or they work at EMO, because Riverside is multi-site. So because of that, we've cohorted staff. They can only work at one site.
As to when the outbreak at La Vérendrye will be declared over is still up in the air. As Loveday says, it takes 14 days from the last known positive case. Adam Riley, TBT News.
Minister of Indigenous Affairs Greg Rickford has provided an update on the $10 million commitment the province made last summer to search for burial sites at the former residential schools in Ontario. Rickford announced the funding at an event in Kenora back in June. Since then, he says his ministry has been working with the Indigenous-led groups to support some projects, most notably the Washajushkanigam First Nation near Kenora. There are also several active applications being considered by the Indigenous groups. Rickford says the communities themselves have taken up the responsibility of helping to organize certain activities, as the situation is more complex than meets the eye.
Our responsibility is to make sure they have the tools to do them. And that's why, in addition to the resources that our government committed and I announced on 2 different places in the last calendar year, some of my other colleagues have come along with additional supports, which I think can help the Indigenous-led group focus on specific recovery and reclamation activities.
Rickford says as soon as they are able to identify other resources, more of the allocated budget can be used to search the 18 former school sites. When we come back, the source of the leak of a confidential information in Fort Frances is revealed and apologized for. Council in Fort Frances has voted to sanction the town's mayor for releasing information to the public that was privy to council only. It came following a closed session of council this past week. But as Adam Riley reports, the decision to go behind closed doors to discuss the matter was not agreed on by all.
Last October, the front page of the Fort Frances Times featured a story which included information that was privy only to senior staff and elected officials for the town of Fort Frances regarding legal correspondence on wood allocation for the Crossroute Forest. In November, a motion was introduced that would have the town's Integrity Commissioner investigate the source of that leak. However, an amended motion passed and the Integrity Commissioner would only advise on the matter. In the lead up to Monday's council meeting, screenshots of emails between Mayor June Call and David Kircher, a resident who had presented to council in July regarding inconsistencies in the forestry license, were uploaded to social media. Those emails contained the sensitive information which would indicate Call as responsible for the leak. Prior to entering the closed session of council, Councillor Douglas Judson decried a decision to have the discussion of a letter council had received in which the author had come to the same conclusion through a Freedom of Information request in the closed session of council.
I do not believe 10.3 is a proper closed item because it contains entirely publicly available and already publicly disclosed materials.
However, Judson's push to have the topic discussed in open council was rejected, and members would then go in camera. Once back in open council, Councillor Andrew Helikis was asked to take over as chair of the meeting to report the discussion, which included the following motion.
The Municipal Council of the town of Fort Frances is very concerned with the unauthorized release of confidential information by the mayor and hereby formally calls upon the mayor to issue a public apology for her action on this matter.
The motion passed unanimously, and Call addressed the matter by apologizing in both writing and verbally. In her apology, Call noted her intentions were aimed to protect both council and staff. She says many different forms of correspondence were received from members of the public, including Kircher, regarding the forestry license.
In an attempt to assist in helping this contact to understand that council, staff, and consultants had been working diligently toward finding answers to the questions we had ourselves, I shared the letter. I should have asked council to give me permission to share the report from the lawyers, and for this, I humbly apologize.
However, Call was adamant she was not responsible for the leak to the media, and as a result was upset at what she called a betrayal of trust.
But I had no part in the leak to the press that recently happened. I feel betrayed and have lost the trust and confidence in my contact, just as I assume council and staff must feel about me.
The motion also called upon Call and the rest of council to undertake training on protecting the confidentiality of the town. Adam Riley, TBT News.
Ontario's Standing Committee on Finance and Economic Affairs was consulting with stakeholders from around the Northwest this week, seeking ideas on what the 2022 provincial budget should contain. Leaders from many local organizations had their say in the virtual pre-budget session with all-party committee. Vasilios Bellos has more.
Discussions surrounded many issues important to those across our region, and not surprisingly, there was a strong focus on topics related to the pandemic. COVID-19 has revealed many problems within the healthcare sector, including here in the region. The Northern Ontario School of Medicine's Assistant Dean, Dr. Sarah Newbury, provided a presentation on their physician workforce strategy, highlighting the medical needs of Northern Ontario.
At last estimate, just under 84% of citizens in Northwestern Ontario reported having a primary care provider, and that is well below the Ontario average of 94%. Life expectancy in the North is 2.5 to 3 years less than the Ontario average.
Newbury also stressed that Northern Ontario as a whole is short 325 physicians. This was an issue prior to COVID-19 that was just made worse by the pandemic. The same can be said about the long-term care sector, also a focus of the pre-budget consultation. Chair of the Thunder Bay Health Coalition, Jules Tupker, provided a presentation explaining the difficulties that come with trying to staff long-term care homes.
Providing new beds doesn't mean anything if you don't have the staff. In my presentation, I talked to you about there were 64 vacant beds in a long-term care facility here in Thunder Bay that they couldn't fill because they don't have the staff.
Another brief presentation was held by Poverty Free Thunder Bay, a local group advocating for change at the local, provincial, and national level. Spokesperson Tracy McKinnon stressed the importance of expanding supports and services for individuals, including what she considers a welfare program that does not provide enough assistance to those in need.
Only $733 a month for full benefits on welfare. If you have no fixed address, it will be a lot less. not enough to live on, not enough to keep up with rent, utilities, and cheap food, not enough for bus fare and endless appointments.
The presentation and question periods that occurred Monday morning will help the provincial government determine how the 2022 budget reflects the needs of Northern Ontario and the province as a whole. Vasilios Bellows, TBT News.
A paramedic with Superior North EMS was sent to hospital this week following a highway crash between an ambulance and a snowplow. It happened Tuesday morning on Highway 17, about 30 kilometers east of Marathon. EMS officials say there was no patient on board and the injuries to the other paramedic were non-life-threatening. The snowplow operator was not hurt. The ambulance was a spare vehicle being taken to Manitouwadge when the collision occurred. Meanwhile, the TransCanada west of Marathon was temporarily closed at the same time that afternoon after a transport went out of control and ended up blocking both lanes on the highway. Traffic was back open to one lane shortly thereafter. Coming up after the break, the province invests several $1 million into Indigenous housing projects here in the Northwest. The Ford government announced an investment this week of $10 million in new annual funding for Ontario Aboriginal Housing Services. That's the agency that originally had plans for a 58-bed supportive housing facility in Thunder Bay. But as Mitchell Ringos explains, the chair of the agency is welcoming the new funding and says the city remains on their priority list for a new facility.
The annual funding is hoping to provide Indigenous-led, culturally appropriate long-term housing solutions and support services to Indigenous peoples experiencing or at risk of homelessness. OHAS currently has over 10,000 housing units across Ontario, with several recent projects in Sioux Lookout, Red Lake, and a new one planned for Kenora. Minister of Indigenous Affairs Greg Rickford says unlike some funding that shrinks over time, this money is for the long term.
This is designed to give people like Justin, like Lorna, and like Cora a sense that not only is their government solidly behind them for the indeterminate future, but that the resources are there to provide some of the things that both Minister Clark and Tobolo have brought today.
You know, today's announcement is critical because it one, not only provides annual funding in order to address critical needs, but it actually has taken that intersectional approach of looking at multiple issues that connect together from different ministries.
Coralie McGuire-Surrett from Thunder Bay is the new chair for OHAS, and she's well aware of the controversy that occurred when the agency tried to build a 58-bed supporting housing facility on Junot Avenue in 2019. The $12 million project ended up being put on hold following opposition from some city councilors and residents in the area. McGuire-Surrett points out that the majority agreed with the benefits of that project, and if it wasn't for those louder voices opposing, it would already be built.
It was actually a really small amount of people who didn't want the housing, which, for me it was nice to see that there was so many other, the larger amount of our community actually did want the project. So to me, it does tell me that there is change happening here locally.
No decisions have been made yet as the funding was just released, but McGuire-Surrett says they will look across Ontario into where this funding will make the largest impact, but Thunder Bay is definitely on the priority list. Mitchell Ringos, TBT News.
A Balmertown resident whose tourist camp has been one of the victims of the global pandemic is celebrating a $2 million lottery win. Rondell Brownlee has been playing the lottery for the last 40 years and took the top prize in Ontario 49 draw on New Year's Day. He calls the win during this tough time an unbelievable blessing and plans to invest most of his winnings, including some back into his business. Brownlee says he also plans to treat himself with a brand new fishing boat. And that's all for this edition of Northwest Newsweek. See you next time.